Watching NDTV 24/7.
Hello and welcome. You're watching Living with COVID. I'm Rishika Barua. This is the show where we help you navigate the new normal in the time of the coronavirus pandemic. Joining us as always is a panel of expert doctors. Dr. Saurabh Arora, an assistant professor, Department of Endocrinology from the Dayanand Medical College in Ludhiana, is with us. Dr. Mahendra Patel, a diabetologist from the Patel's Diabetes Care Center, joining us from Thane at the moment. And Dr. G. Justin Paul, he is the State Heart Attack Program Nodal Officer from Tamil Nadu, the Government Professor of Cardiology at the Madras Medical College, Chennai, also with us. Appreciate you, doctors, for sparing the time of day. I want to begin by asking you about patients who are scared to visit hospitals and clinics because of the fear of the COVID-19. What's the advice that you would like to give them? Dr. Paul, if I can come to you at this moment, how do you manage to conduct procedures like ECGs or, blood pressure measurements in these times? Is it safe to use, common equipment? What are the kind of safeguards that you've put in place?
So the healthcare worker and the patients, they both wear masks when they come into the clinic. The healthcare worker sanitizes their hands before touching the patient. They stand beside the patient, avoiding face-to-face contact, and they check the blood pressure with an automated BP machine, and also check the pulse oximeter saturation and the heart rate. Coming to the ECG part, the patient's upper torso is freed up. The healthcare worker makes sure that they wear a new glove for every ECG. They don a face mask. The patient also dons a face mask. The patient looks to the other side when the healthcare worker takes care in fixing the leads. In this way, they minimize the contact with the patient. The ECG and the blood pressure can be safely recorded in any system if proper precautions are followed, and patients need not worry for coming to the clinics for checking their BP and the ECG.
Let me come across to you, Dr. Paul, because the other important question, of course, is susceptibility to COVID-19 for those who are suffering from a heart disease. How can they lower their risk of contracting the infection, and what are some of the complications that heart patients can develop, God forbid, if they do contract the infection?
First, I would like to reassure that as of now, there is no evidence that majority of the cardiac patients have a higher risk of contracting COVID-19 when compared to the general population. So please do not panic if you have a heart disease. Having said that, it is also important to recognize that certain patients with some conditions like post-cardiac transplant who are on immunosuppressants, heart failure, or severe pulmonary hypertension, they are at a higher risk of getting COVID infection. So they need to be extra careful. Now, once infected, these patients with underlying heart disease, they have a higher risk of getting complications when compared to most other patients. The death rates of as high as 10 to 11% have been recorded in patients with heart disease who contract COVID compared to general population where the death rate is 1 to 2%. These patients may present to us with heart attacks without blocks when we do an angiogram. This has been an unusual presentation we often see. The patients can present to us with heart muscle infection, what we call myocarditis, and they can present with heart failure. The presentations of COVID and heart has been quite varied, and it is very important that the patients, they recognize the symptoms early and they come to the hospital. If they come early, the treatment can be offered better and they can be saved.
All right, so it's not like a young person can't get the coronavirus. They can, but the chances of them developing complications are lower. So the chances of them making a full recovery after contracting the infection are higher. Very interesting. Dr. Paul, what about procedures like angioplasty, angiography during the time of a pandemic? Can they be held off for a later date, or is that more risky than actually doing it now?
Angioplasty is by and large a safe procedure with more than 99% success rate, with majority of the patients coming out without complications in COVID season or not.
Right.
The question is how COVID safe it is. I'm happy to share with you that most of the hospitals have made necessary changes in the infrastructure, and most of the healthcare workers in this cardiac environment have had necessary training in the way that they made the cross-infection chances are very less between the patient and the healthcare workers. So if the patient has a need to reach out to the hospital for an angioplasty, they need not hesitate despite the pandemic setting. Now there are two types of, you can broadly classify them into two varieties: emergency angioplasty and elective angioplasty. What is this emergency angioplasty? If a delay in angioplasty can lead to death of the patient or any damage to the organs of the patient, or is going to give a very poor quality of lifestyle to the patient despite optimal medications, we can consider them an emergency angioplasty. Angioplasties to heart attack, they fall into this particular category. When a patient develops a heart attack, the best treatment will be doing an angiogram at the earliest and removing the block and putting in a stent in its place. I won't impress upon that during the last 2 to 3 months across the world, there has been a 30 to 50% decrease in the number of patients reporting to the hospital with a heart attack. Initially, it was thought it is a good sign. Later, it was realized that many patients are dying in home and they have not sought the hospital fearing the COVID-19 pandemic. So I want to impress upon the viewers here that an untreated heart attack can kill a patient 10 times more likely than a COVID.
Right.
So it is very important to seek medical attention without delay if they have symptoms of heart attack.
Well, I think that's...
other group,
right. Go ahead,
the
doctor.
elective
Please complete your point.
where it's a non-emergency angioplasty, most incidentally detected blocks in the blood vessels or blocks where the symptoms are very well controlled, by and large can wait couple of months. Your cardiologist who's treating you will be able to guide you. Except certain blocks in important location like left main, most other blocks, if the patient is stable, can wait. So if your cardiologist is asking you to wait for 2 to 3 months or 4 months, do not worry, be reassured. To summarize, angioplasty is a very safe procedure in these times. So please reach out to the hospital if you have any symptoms suggestive of heart attack.
All right. Please reach out if you have symptoms of a heart attack, or if you are a heart patient or any patient with a comorbidity. It's extremely important that you take care of yourself, take extra precautions and seek medical help, because like our panel of expert doctors has been saying, it is safe and they themselves are taking all the precautions. We'll continue this conversation. We're going to slip into a very short break. The doctors will be live with us on the other side. To stay tuned. Dr. Paul, what about treatment for heart diseases at this time? What is usually effective treatments? Do they hold in the time of a pandemic? Or, are there different rules and regulations that apply when it comes to managing heart conditions?
In the government of Tamil Nadu, we have established a heart attack management program at a cost of almost 100 crores in our state, the first of its kind in the country. Our system involves 18 government medical college hospitals, which have been provided with cardiac catheterization laboratories worth 4 crores, which are linked to 154 district hospitals and taluk hospitals in a hub and spoke model, forming 18 heart attack management clusters across the state of Tamil Nadu. The primary aim is to provide immediate angiogram and angioplasty to patients with a heart attack so that we can save lives. But now, considering the present scenario, we have issued some 2 COVID-specific focus recommendations to ensure that our system remains COVID safe. At the same time, the patients do get the best appropriate care for heart attack, despite the fact that many of our government cardiology colleagues are in the front line of COVID management as well. What we have recognized is the healthcare workers are the currency coins of our healthcare delivery. So we have taken all steps to protect them. We have trained them in the use of personal protective equipments. We have trained them in keeping the working environment and the equipment safe and the patients COVID safe. Every patient coming to the cardiac emergency is considered as a potentially COVID positive patient, and the healthcare workers are expected to wear personal protective equipments. As a result, they work confidently and the healthcare delivery continues even in the COVID season. The other important change that we have done is in the pharmacoinvasive therapy. Pharmacoinvasive therapy is considered in settings like district hospitals or taluk hospitals, where you don't have the cardiac catheterization facility. There we thrombolize the patient, that is giving the clot busting drug at the earliest and referring to the main hospital for angiogram. In this season, if the hospital is in the red zone, we have advised to avoid routine referrals. Only patients who are very sick and in an emergency situation, we advise them to refer. These are some of the steps that we have taken in our system. The other important step is that to reduce the footfall of patients in the hospital, we have encouraged our hospitals to start teleconsultations to help the patients to cover the pandemic situation. We have been issuing free medicines almost for 2 weeks in every visit for our patient. This time we have increased to 2 months. This also reduces the footfall of the patients during the COVID season. We are also telling the patient the basic important thing. 80% of the transmission of COVID happens between our own hands and our own face. So if we take effective steps to make sure that we don't touch our face without washing our hands well, we protect 80% of the infections.
All right.
The remaining 20 is between face-to-face contact and environment-to-face contact. A properly donned face mask is going to protect that as well. So we encourage our patients to follow this and stay confident. I am sure they will be fine.
All right, I think that's a very comprehensive update as far as management of chronic diseases for heart patients is concerned. Appreciate you doctors for sparing the time of day to answer our questions so very patiently. It's been a pleasure talking to you. Thank you very much.